Hello, hi, my name is Lauren Ashley Alexander, and today I will be discussing Chagas disease. In my presentation, I will be discussing the origins of the disease, where to find it, the symptoms and how to treat it, Chagas in the US, and where to find it in New York. Here are my table of contents and the figures that I will be using throughout the presentation. Okay, when was Chagas disease first discovered? A. 1903, B. 1899, C. 1905, or D. 1909? The answer is 1909. Chagas disease is also known as the American trypanosomiasis and was discovered by the Brazilian physician and researcher Carlos Chagas in 1909. This disease is transmitted by a parasite called the Trypanosoma cruzi, or T. cruz for short, and found in rural areas of the Americas, Central and South America, and Mexico. Okay. Which country has the highest prevalence of Chagas disease? Is it A, Nicaragua, B, Bolivia, C, Peru, or D, Mexico? Let's find out the answer. The answer, Bolivia. And as you can see in this chart, the prevalence of Chagas disease across Latin American countries, and highlighted in the yellow is Bolivia with the highest prevalence at 18.3. How many people across Latin America are estimated to be infected with Chagas disease? Is it 6 to 7 million? 4 to 5 million? 300,000 to 500,000? Or 70,000? Do you think you know the number? Okay, here's the answer. 6 to 7 million people across Latin America are estimated to be infected with Chagas disease. What are the symptoms of Chagas disease and how do you treat it? Chagas disease presents in two phases. In the acute phase, this lasts for 1 to 2 months, and the parasites circulate within the bloodstream and cause non-specific symptoms that are not limited to fever, enlarged lymph glands, muscle pain, and difficulty breathing. In the chronic phase, parasites become hidden mainly in the heart and digestive muscles, and up to 3 decades later, patients can suffer from cardiac issues and suffer from enlarged esophagus or colon. And much later down the line, patients can experience progressive heart failure and even sudden death. How do we treat Chagas disease? Chagas disease is treated with benzimidazole and nifurtimox. Both medications work effectively at treating Chagas disease, but once administered at the acute stage. The longer the person has the disease, the less effective treatment becomes. Treatment is also crucial for those who have been reinfected and also for girls at childbearing age during the early chronic stages to prevent congenital transmission during pregnancy. Chagas in the US. Because of migration, the parasite and insect vector, the triatamine bug, has caused cases of Chagas disease within the southern states in the US. It is estimated that in 2016, over 230,000 people in the US were living with Chagas disease without even being aware. And as you can see in this map, in the highlighted blue areas are states that have high rural areas where the bug has transmitted Chagas disease. What is a triatamine bug commonly known as? A, the blood bug, B, the kissing bug, C, the stink bug, or D, the purple bug? Let's find out. Answer, the kissing bug. It is known as the kissing bug is because the bug primarily likes to bite on people's faces, primarily around the eye area while they are sleeping. Chagas in New York. In a case that was reported by Zen Crystal et al., this was a retrospective study that used demographic information from patients in 2005 and 2017 that were treated for Chagas disease at the Jacobi Medical Center at the Tropical Disease Clinic. There are 60 patients in total, 30 male and 30 female, from varying countries in Latin America. The patients received treatment. Half of the patients were asymptomatic, the other half received treatment. 7 patients did not complete the study due to the side effects or loss to follow-up, and 10 patients had advanced cardiac heart failure and had to receive transplants. Okay, final round of questions. When is World Chagas Day? A, March 16th, B, February 23rd, C, April 14th, or D, May 3rd? The answer is April 14th is recognized as World Chagas Disease Day is because the first reported case of Chagas disease was reported on April 14th by Carlos Chagas. Here are my references. In summary, Chagas disease is treatable with early detection. Migration has led to the spread of the disease to the U.S., and the CDC recognizes it to raise awareness and prevention of the disease. Thank you so much.